Hey guys, thank you so much for joining. I'm going to show you quickly how to set up your device and set up a patient in your Modpod. So the first thing you're going to want to do is to take your neck cushion out of the back of the Modpod. You have a choice between a 20, a 15, and a 10-degree angle wedge. Typically we say the 20-degree is the most universal, and to go ahead and start with the 20-degree angle wedge. So you'll put on your shoulder pad, put on the wedge. You want the large side facing towards the rear of the device. You're going to want to insert your patient switch in the back of the device. You have to have your patient switch in order for the device to do treatments. From there, you are going to take your larger of the two straps with the inseam facing towards the rear of the device, and you're going to feed it through your Modpod. I'm going to zoom it in a second so you can see. Let's see. So what you're going to be looking for is you want about an inch and a half on both sides. I'm actually going to pull this one up a little bit more. Because you want it to be about a finger distance in between the neck wedge and your strap. And so this is what you're going to be looking for right here. And about this much distance in between. From there, all you have to do is decide which protocol you want. And so I will show you quickly how to do that as well. So you have your device. Let's see if I can zoom it in anymore. Good for focus. Perfect. So you have your device, and what you're going to want to do is if you click your arrow, it'll take you to the default protocol, which is the 2014 Julie Fritz study. And that study is particularly effective with patients with radiculopathy. And what it is a 60-second hold, 20-second rest for 15 minutes on a slow motor speed. So if you wanted to use this protocol, all you would have to do is put in your poundage, which we typically say start 10 to 12 pounds, and your minimum is going to be half of your maximum. So if I was doing a 12-pound max, my minimum would be 6 pounds. And so if you wanted to use this study or this protocol, all you would have to do is click play and you would be starting. But say you want to customize a protocol. You would have that ability. All you would have to do is click your scroll, choose intermittent or static. Click next, your treatment time, your motor speed, hold time, rest time, and then you can save it. So once you save a protocol that you like an oscillating protocol, that's the one that I created. Here's the protocol I just created. All I have to do is click it, put in poundage, and I'm ready to go. So that's kind of how you use the technology, a brief kind of overview. So now I'm going to show you what it looks like to set a patient in the device. Let's see if I can zoom out a little bit. Okay. So what you're going to see me do is push the strap back and really guide his head into the device. Come on up. Come on up. And what I'm doing right now is I'm feeling for his occipital. Come on up a little bit more for me. Perfect, relax. Okay, so I feel his occipital right here, and I'm making sure that the band is underneath, and that's super important. So what you want is you want the strap to be snug, but he's not suspended in the air. You can see he's still resting on the cushion. So this is where you want the band. And so you're going to take your forehead strap, and you want the inseam facing up. So what you're really looking for is you want Brent's forehead to be in between the brackets. So I'm actually going to have Brent scoot down the table slightly. Perfect. And what this does is it generates some pre-traction just by him taking the slack out of the line. And it really places his forehead in between the brackets. So you're going to put it on. And from there, all you have to do is put in your protocol and you can start treatment. You also then have the ability to engage manually if you wanted to. You have full access to the cervical region. So you can use modalities, you can use hands-on engagement, use your clinical expertise to really take advantage of this cervical area. And so if you have any other questions, don't hesitate to call. I'm here to answer them for you. Thank you so much for your time.